You're not. All right, we've got Dr. Ken Randall joining us with the Tennessee River Dental. How are you?
Doing great. Thanks for having me today.
Have you been getting any sleep lately?
So, you know, it's one of those things you take what you can get.
Yeah, that's right, a new dad. All right. Hey, thanks for joining us. All right, let's first start off with digital dentistry.
Yeah.
Dentistry has come a long way when it comes to technology.
It really has. So it's interesting. My grandfather was a dentist, and he's been practicing over 50 years now.
Oh, wow.
And comparing the way that he practiced dentistry to the way that we have the ability to practice today is just unbelievable.
I believe it. Well, when it comes to digital dentistry, well, what is that?
So digital dentistry, just like we've seen a lot of other industries go from more of an analog system to a digital system, we're starting to be able to do that with dentistry as well when it relates to teeth and our mouths and that kind of thing. So for example, one of the areas in digital dentistry that's really growing right now is the ability to digitally scan somebody's mouth. And we have, basically it's a fancy camera on a stick, if you will, that we can use and image somebody's teeth and gums. And then from that image we can design a crown, for example, mill it immediately.
Like same-day crowns?
Same-day crowns. We can get somebody numb. Generally, they like us better if we numb them up first. And
thank you.
So yeah, we do that. We'll design the crown, image everything, make it on the machine, and then next thing we know, we have a crown ready to go that same day.
And is this what we're looking at right now?
So yeah, this is a crown that's coming out of the furnace after it's been sintered. This particular material here is the strongest material that we have available to make crowns out of. Our furnace heats it up just over 3,000 degrees.
Wow.
And gets it to its final form in there.
Now this is, you don't have to send this off, this is at your location?
Correct, yeah. So we use a lot of the same processes and materials, but we're able to cut out some of the steps where there's potentially margin for error or something like that. We can get an excellent fit for those crowns and make it more convenient for our patients.
That's amazing. That's the first time I've seen that video. That's absolutely fascinating. So it's with this technology, especially in the digital age, you can get it same day, and that week, at the end of the week, you can your patients can have a crown.
Yeah, walk out the same day, you're ready to eat dinner that night, and don't have to worry about a temporary crown coming off or some of the other issues that we can sometimes see in that interim.
That's amazing. Okay, April is National Facial Protection Month, and hats off to you, what you've been doing with our area athletes, hundreds of them, providing them with mouthpieces. It's very important to wear a mouthpiece and protect our teeth.
We feel that it is, and you know, we're coming from a dental background where we deal with teeth and mouths all the time, but it's really sad when you have folks come in that unfortunately haven't been able to wear a mouth guard in there, and you know, we'll have teeth that can be broken, can be knocked out, and it's something that doesn't necessarily just follow them when they get injured immediately, but also something that continues to follow them for the rest of their lives.
Yeah. I mean, something like this costs what, $1.50? I'm going back to my high school days in football.
Yeah, so there's kind of a range of different mouth guards out there, which a lot of people don't necessarily realize. We have mouth guards that you traditionally get at the sporting goods stores, what we call just regular mouth guards in there, more of a boil and bite kind where you heat it up and you bite on it. Right. And then your dentist can actually make you custom mouth guards where we can take an impression of your teeth and get something that fits a lot better to our teeth, tends to be more comfortable and allows you to function without having to worry about a bigger piece of plastic in your mouth.
All right, Dr. Randall, thank you very much. April is also Oral Cancer Awareness Month. We all need to keep that in mind. And you know what, I've interviewed a few dentists in my career, and you have got the widest, straightest teeth I've ever seen from any dentist. Tennessee River Dental, 4845 Hixson Pike, Suite C, Hixson, Tennessee, 877-3848, TennesseeRiverDental.com. Thank you very much.
Thanks for having me back.